Hello, welcome to our class. And this is week 16, and we are going to talk about the stuff regarding psychological disorders and the treatment of these disorders. And the content is covered in chapter 15 and chapter 16 of the textbook. So this week we're going to actually learning about two chapters. So, and also this week is the last week that we will have the lecture. So starting from next week, we will not have any lectures anymore. Yeah, so next week we are going to have the review for the final exam. And then the week from the 2 weeks from now is like the final week, the finals week. So this week is actually the final week that we will have the lectures. So let's start the lecture for this week. Before talking about psychological disorders, I want to share you about the story of Stepan. So Stepan is a guy that I knew from my college. So when I was in college, I had a schoolmate whose name is Stepan. So that name is from Europe, from Ukraine. So because he had his family was migrated from Ukraine, a European country. So his name is like Ukrainian name, Stepan. So it's like it's like a Stephen in English, but he insisted everyone to call him Stepan. So Stepan had a really serious psychological problem. He actually diagnosed with social anxiety disorder. He told us that story. So when I talked to him, because we knew each other, because we were all psychology major students. So he studied psychology. I also studied psychology in college. So we know each other. And then we got familiar with each other, and he started to talk about his own story. He said that in his high school, he couldn't talk to people, especially to girls, because he was so anxious, too anxious to talk to people. And later he found that he couldn't go to school because he was too anxious every day. Because in high school, there were, lots of people, lots of students, lots of peers, and they talk to each other, they hang out, they do other things together. He couldn't do that. He couldn't talk to people. He couldn't interact normally with other students. So there was one day that he decided not going to school. So he stayed at home, not go to school because he couldn't do that. He stayed at home for more than 2 years. So he just stayed at home and hang out with his own family members. So his family members were okay. So he was totally okay talking to his family, but not okay talking to other people in school, in public. So he stayed at home for more than 2 years. But finally, he graduated from high school and he went to the college. That's why I met him. And but he was not really okay talking to people in college, and he was like a little bit hesitant to talk to people. I first met him. I thought that he was okay, but he was just shy. But later I found his story from his mouth that he was really diagnosed with social anxiety disorder. And he tried to recover from that disorder. He tried to assimilate to the society and talk to people. And this is a little story from my friend, Stepan. And I think that he was the person who I met, and I was impressive for having a psychological disorder. That it was my direct experience of meeting somebody who had really severe psychological disorder. So I think this week's lecture was very meaningful because there are some people who suffer from different kinds of psychological disorders, and they try to be healthy, they try to recover. And I hope that the lecture for this week will be helpful for them. So let's go to the lecture. So let's know about what psychological disorders are. So let's have some kind of basic understandings of psychological disorders. So what is it? What is a psychological disorder? So that is a condition categorized by abnormal thoughts, feelings, and behaviors. So that is somebody's condition. In that condition, that person has some kind of thoughts, feelings, and behaviors that are not considered as normal. So has some kind of weird thoughts and weird feelings and weird behaviors. That kind of condition. But this definition was really vague. So what is, you may ask, what is abnormal thoughts? What is abnormal feelings and behaviors? Who can decide those behaviors, feelings, and thoughts are normal or abnormal? So who can decide? So we have these questions. So we know that people oftentimes have some kind of psychological states that are not really healthy, such as depression, such as sleep problems, such as sadness. We may be really sad, we cry for something. And we can have some kind of wrong beliefs about things, about people, such as discrimination, such as prejudice, right? So we have a lot of this kind of psychological problems, or the psychological states that are not that healthy. We may be sad, we may be really depressed, we may be really anxious in life, we may be really stressed, we may be burnout. Last week we talked about burnout, stress, and stuff. We might have those kind of unhealthy psychological states, but are those considered as psychological disorders? Maybe not, maybe yes. Yeah, so to what degree these thoughts, feelings, and behaviors are considered as abnormal. And these thoughts, feelings, and behaviors are used to diagnose psychological disorders. So to what degree these abnormal thoughts, feelings, and behaviors can be abnormal enough to be used as the judgment, as the criteria to diagnose psychological disorders. So that's the problem that we have. And also another problem is that how do we know that some characteristics that few people have are abnormal or not? So you know that some features or characteristics are few people have. I mean, like a really minority of people will have those characteristics. Are those characteristics considered as normal? Because they are all not really often seen by a lot of people. So one example is the red hair. Is red hair a abnormal biological feature? So that is a question to ask. So like there is a very small percentage of population has red hair. Is red hair a abnormal feature? That is a question to ask. And also another example is homosexuality. So nowadays we consider homosexuality is the same with heterosexuality, is the same with bisexuality. Homosexuality is just only like a less than 5% of the population is homosexual. We cannot think that is abnormal. We just think that very few people have that feature. But many years ago, like 50 years ago, homosexuality is considered as a psychological disorder. They really did. So those psychologists or psychiatrists really thought that homosexuality was a psychological disorder, and they published papers. Even they published papers online, not online. They published papers on the journals, and they try to figure out how to give treatment to homosexual people, to turn their homosexuality to heterosexuality. So nowadays we saw those papers are I think that those papers were really funny, but those were published journal peer reviewed journal papers. Yeah, so how do we judge some characteristics that few people have are abnormal or not? So these are several questions that we need to ask. But fortunately, we have the criteria, formal criteria. Those criteria are from a organization. It's called American Psychiatric Association, or it's called the APA. So American Psychiatric Association, APA. So they make this criteria to judge whether people suffer from a certain psychological disorder or not. So there are some criteria to judge whether people have a particular psychological disorder. Yes, so there are some principles here on this slide. These are general guidelines. There are specific criteria for each psychological disorder, but these are the general principles for how to judge whether one has a psychological disorder or not. So first of all, that person need to have some significant disturbances in thoughts, feelings, and behaviors. So those patterns of thoughts, feelings, behaviors are not usual, very unusual, and those patterns are self-defeating. So they have a lot of disturbances in life. And also these disturbances are not because of other reasons, but because of some kind of dysfunctions in their life, in their mind, or in their body. Some biological, psychological, or developmental dysfunction. Because his life or her life, in some aspects, is dysfunctional. There's some kind of dysfunction in his or her life. So there are some disturbances. And also these disturbances lead to some kind of consequences. Those consequences are significant distress or disability in their life. So because of those disturbances, they cannot have normal life. They have some kind of a disability or distress in their life. And these disturbances are not due to culture, not due to culturally approved responses. You know that in some cultures, they have really unique patterns of thoughts, feelings, and behaviors. And when people have some kind of disturbances because of that culture, those disturbances are not considered as the criteria to judge one has the psychological disorder, because that is from the particular culture, right? So those disturbances are not from culture, not from the society, but from the dysfunctions of a person's life, person's mind, or person's development, or person's physical body. So these are the general principles to judge whether one has a psychological disorder or not. So it's not just all that person's feelings are abnormal. So it's not that big. There are some specific standards to judge. And the APA, the American Psychiatric Association, published a book. It's called the Diagnostic and the Statistical Manual of Mental Disorders. or it's called DSM-5. There are other 4 older editions of DSM. So DSM-5 is the newest one. So we usually use this book or document as the standard to judge whether one has a psychological disorder or not. So diagnosis means appropriately identifying and labeling a set of symptoms. So diagnosis is a process of identifying a particular psychological disorder. Yeah. So it is the manual for the diagnosis of psychological disorders. And based on the DSM-5, there are some disorders, and we can categorize those disorders into several categories. So we can see that here's a chart from the textbook. We can see that most people have the most frequent disorder is called the major depressive disorder. You can see there are a lot of people. In total, there are more than 15% of the population was diagnosed with major depressive disorder. That was a really high percentage, I think. And also there is alcohol abuse. So they consider alcohol abuse as a disorder. It's not just the drinking alcohol a lot one time. That is the frequent use of alcohol for many times. So it is considered as a disorder. And the next one is specific phobia. So phobia is a kind of a disorder that people is extremely afraid of something. So specific phobia, there are a lot of kinds of phobia. So people may be afraid of spiders. People might be afraid of snakes. So there are different kinds of phobia. And the next one is social anxiety disorder. You can see a lot of people, like more than 10% of people have or had a social anxiety disorder. And the next one is drug abuse. So it's the same with alcohol abuse. It's a disorder. And also there is post-traumatic distress disorder. So I mentioned this last week. It is a disorder that people have when they had the really traumatic events. Afterwards, they may get this disorder. And also there is generalized anxiety disorder. And also there is panic disorder. Panic disorder, so people who have a panic disorder, they get panic suddenly for no reason. So that is a panic disorder. And also there is obsessive compulsive disorder. And also there is dysthymia. And then also there are a lot of other kinds of disorders as well. Yeah, such as multi-personality. So people have different kinds of different personalities. They think they're different people. And but that kind of a disorder is really rare in society. Although that kind of a disorder is really popular in movies or fictions because it's really interesting. Sounds really interesting. The person changes the identity totally without knowing it. But really rarely there are people who suffer that kind of a disorder. So most of the people, a lot of people who have the mental disorders will be diagnosed with those major depressive disorder or phobia. So this kind of disorders or drug abuse. So in the textbook, there is a lot of introduction about every kind of psychological disorders. But in the lecture, because of the time limits, we can introduce some of those psychological disorders. And before talking about specific disorders, we can talk about the reasons for why people have disorders. So why people suffer from disorders? What are the causes of psychological disorders? So there are some theories or understandings for why people suffer from psychological disorders. So there is a common sense or common place that they think that the psychiatrists or psychologists think that both predispositions and environmental factors lead to the onset of a psychological disorder. That means that why people have disorders, because of the two reasons. The first reason is their own predispositions, and the second reason is the some kind of elements or factors from the environment. And first, some people are themselves vulnerable to disorders because they have certain predispositions, such as genetic factors. Because of those genetic factors, people are really vulnerable to disorders. For example, some people got schizophrenia because of the genetic factors, because their mother or father or their grandma or grandpa, in their family history, there is a history of schizophrenia. So a lot of their ancestors got schizophrenia, and they also got schizophrenia. Even though they have really successful life, they are normal at the beginning, they have a normal life, they didn't suffer from like traumatic events. They didn't have those, but they eventually got schizophrenia. For what? Because they have the genetic. They have this kind of DNA to suffer from that kind of a psychological disorder. So some people are really vulnerable to disorders. That is because of their own predispositions. They are built as people who had a really possibility to suffer from a certain psychological disorder. That is from one aspect for why people have psychological disorders. And another aspect is from the environment. So some people living in the environments are really difficult, really adverse, really unfriendly. So those adverse environments pressure people to suffer from disorders. So they don't have the predispositions. They are normal. They don't have any DNAs who make them vulnerable, but they're living in really bad environments. So finally, they suffer from a particular psychological disorder, or they might experience some kind of really traumatic events or really bad events. So people have different experiences. They meet different things, and they live in different environments. And in some environments are really nice, really friendly to people, and some environments are really difficult, really adverse. So the interaction, both the predispositions and the environments make people to have the psychological disorder. And oftentimes there is a interaction between the two aspects. So for example, if the person has a really vulnerable predisposition and also they living in very adverse environments, there is a high frequency that this kind of people suffer from psychological disorder. If the predisposition is not that like that, and they living in the good environment, that there is a very low frequency that the people, this kind of people will have the psychological disorder. Yeah, you might ask if the person who living in really stressful environment, really adverse environment, and that person doesn't have that kind of a predisposition, what is the frequency? I would guess that the frequency is not really high, because even though those people living in really adverse environments, but they have a really strong predispositions, they may overcome this difficult environment. So this kind of understanding of the causes of psychological disorder is concluded and summarized in a model called the diathesis stress model. So this model is a basic understanding. So it becomes guideline for clinical psychologists to understand the onset or cause of psychological disorders. When they try to discover what factors can cause certain psychological disorder, they use this model to understand. So they found certain people's predispositions, and then they found the environmental factors that those patients have living in. So it's called diathesis stress model. So stress is the adverse environment. So those environment make them to have stress. And the diathesis basically means the predisposition. So it's like predisposition environment model, but it's called diathesis stress model. So let's look at some kind of disorders. So because of the time limit, we cannot introduce each type of psychological disorder because there are a lot. You can read them in the textbook. There are a lot of introductions. So in a lecture for this week, we can introduce certain disorders. Let's know about them. The first one we can know about is the generalized anxiety disorder. So there is a very big category of psychological disorders. It's called anxiety disorders. So those disorders, most apparent feature is that people have a lot of anxiety. So there are different kinds of anxiety disorders. Generalized anxiety disorder is one type of anxiety disorders. So let's say what is that? What is generalized anxiety disorder? So the patients have a continuous state of excessive, uncontrollable, and pointless worry and apprehension. So the patients have too much anxiety, too much worry, too much apprehension, and then they cannot control those anxiety. It's not controllable, it's uncontrollable. And also oftentimes those worry and those anxiety doesn't make sense. It's not really help. Those anxiety does not help us to adapt to the society. So what is the worry that have points? So sometimes we'll have the exam and we are anxious before the exam because we worry that we will not have a good grade in the exam in the future. That is the anxiety that is on point, right? So some kind of a pointless anxiety, we'll have the example later, but oftentimes they don't have to have those anxiety, but they have. That is really pointless. So their example that I heard of, there is a woman who has this generalized anxiety disorder. She worries that her husband's toes will be hurt badly when her husband goes out. So every time her husband go to work and go outside, she was too worried because she's worried so much that her husband's toes will be will be destroyed or hurt badly. That anxiety is totally pointless, right? So that doesn't make sense doesn't make sense at all, right? So how her husband's toes will be hurt? It is possible. It is possible that her husband get the car accidents or get some kind of accidents. But no normal people will worry about that, right? So the thing that the people should worry or worth worrying about should be like whether this guy will have car accidents or not, right? So whether, yeah, so other kinds of anxiety, but husband's toes, his toes will be hurt. That is not something that people usually worry about. That's one example. So anxiety, that is something that everyone have. Everyone has anxiety at some point. But too much and pointless anxiety is dysfunctional. So that kind of anxiety has been really dysfunctional. So make people cannot have a normal life. Their life is heavily disturbed by those kind of anxiety. So that we say that that anxiety is dysfunctional, does not function very well. Sometimes our anxiety help us to get prepared, right? So we feel anxious so that we get prepared for something that we need to do. But that kind of anxiety that those patients have is too much and pointless, doesn't make sense, has been very dysfunctional in their life. So this is a generalized anxiety disorder. And another type of anxiety disorder is called a social anxiety disorder. So it's not generalized, it's social, it's about the social life. That is the extreme and persistent fear or anxiety or worry about social situations. And also there is behavior part, it's the avoidance of social situations. And what kind of social situations? In those kind of social situations, the person could potentially be evaluated negatively by others. So in a certain social situation that other people might perceive this person negatively, in those kind of social situations, that person has too much fear and has a lot of fear, persistent fear and anxiety. And also that person avoided that kind of social situations. And based on the statistics, over 12% of all Americans experience this disorder during their life. That means that they are having this kind of disorder, or they used to have this kind of disorder. So this kind of people account for 12% of all the population in the United States. So you can see how prevalent this disorder is. Like 10%, like 1 of the 10 people that you meet in the society used to or having the social anxiety disorder. And they are too concerned that they may act in a embarrassing way, and they are too concerned that they are judged negatively by others. So that's why they have too much anxiety, because they are too concerned about their own behaviors in front of other people. They are too concerned that they will be judged negatively by others. And one example is the story that I shared with you at the beginning of the lecture, the story of the Stepan. So Stepan could not talk with others in high school or in public. He just couldn't talk to others. And there is another example that I saw in the documentary. So that guy couldn't write in public. So for example, sometimes you need to write the check, right? So you need to pay to the hotel or pay to the supermarket. Sometimes the people use the checkbook. People need to write down the number and the signature, right? So that guy could not write in public, couldn't do that. He was okay talking to others, but he was not okay writing in public. His writings cannot be seen by others. He couldn't just write down something in front of other people. So that's like one example of social anxiety disorder. And also they have certain actions. They may take actions to reduce this kind of too much fear and anxiety. So they have the avoidance behaviors. They avoid going to those social situations. For example, Stepan avoided going to school. He just didn't go to school at all and stayed at home for more than 2 years. Because he had too much anxiety and fear, he couldn't deal with it. He couldn't deal with that kind of amount of anxiety in their mind. So he chose not to engage in those kind of situations. So this is our features of social anxiety disorder. So it's kind of a little bit different from generalized anxiety disorders. And the next one is major depressive disorder. So last two examples we talked about are all categorized in anxiety disorders. And this disorder is one kind of a mood disorders. So mood disorders, the common features of this kind of disorders are that people have abnormal moods. So we talk about mood in chapter talking about emotion and motivation, right? So we can tell the difference between emotion and the mood. So people who suffer from mood disorders, they have very unusual mood patterns, the patterns of moods. And the major depressive disorder is one of the mood disorders. So it's okay to have depression sometimes for a short period of time. So for example, 2 hours or 1 day or 2 days. It's okay. All people will experience depression sometimes in their life, but it goes away really fast. It disappears really fast because our mood is like, our emotional mood is fluctuating all the time. It's changing all the time. The mood and emotions are changing all the time. However, so the people who have the major depressive disorders, they are depressed or sad most of the day. And that situation lasts for more than 2 weeks. They are sad or depressed for more than 2 weeks. Some kind of patients who got this disorder severely, they are depressed for more than 1 year or 2 years or 3 years or forever. They're sad or depressed forever. And secondly, they no longer have the interest or enjoyment in something that they're doing usually for more than 2 weeks. So first, they have a really sad mood or depressed mood for more than 2 weeks. And the second, they don't have any interest or enjoyment in things that they are doing for more than 2 weeks. So these two are the judgment or the standards to diagnose major depressive disorder. That means that if you somebody go to a clinic and have a diagnosis, if that person is depressed for more than 2 weeks, almost all the time, every day, and secondly, that person lose the interest or enjoyment in doing something for more than 2 weeks, that person can be diagnosed with major depressive disorder. So these two standards are the key standards to judge whether one has a major depressive disorder or not. And also there are other symptoms for those who have major depressive disorder. So this kind of disorder can be accompanied with other symptoms. So you can see weight loss or weight gain. So only weight loss or weight gain, we cannot use that as the standard to judge major depressive disorder, but it's a symptom that accompanies with these two. So this symptom must follows with these two symptoms. So this two is the key point, right? So this is just a symptom that follows that two symptoms. So weight loss or weight gain. And another one is difficulty falling asleep or sleeping too much. Sometimes people who have this kind of disorder cannot fall asleep because they are too depressed. And sometimes other patients, they have too much sleep. And yeah, so these two totally different symptoms are all symptoms for those who have major depressive disorder. And sometimes they have the agitation or retardation. So they move very slowly or they don't move. And they have the, might have the fatigue or loss of energy. They got really tired every day. And they have the feelings of guilt or worthlessness. They think their life is not worthy. And there's no meaning in their life. And they have the difficulty concentrating. They cannot focus on something. They don't have that kind of attention to focus on something. And also, they might have the intent to commit suicide. They want to kill themselves. They have that kind of idea. Sometimes, for some people, they really do. They really commit suicide. For those who have major depressive disorder, because they cannot bear with it. They cannot deal with it. They're too painful in their mind, so they decide to commit suicide. So you can see that this kind of a disorder is a disorder that people have the depression all the time. They cannot go back to the normal level. So for normal people, they can be depressed, but for a very short period of time because the emotion and mood is always changing. And there is a tendency that people's mood will go back to a baseline. So there is a baseline for everybody's emotion. So that baseline is where that people are not too happy or not too sad. So that baseline is usually some kind of somewhere that is neutral, or you can see it as calm. So most of the time when people's emotion or mood is on that baseline, people are calm. People just don't have a lot of strong mood or emotions. They are not too happy or they are not too sad. So that is the situation on the baseline. So there is a tendency that the people's mood or emotion will go back to the baseline, no matter what. No matter they have really traumatic events, their family members are pass away. They are really sad for a long time, but eventually their mood or emotion will go back to the baseline for normal people. But for people who have major depressive disorder, their mood cannot go back to the baseline. They are always depressed, always sad, for no reason, not because they meet something difficult, not because there is difficulty in their life, but because their baseline is depression. I mean like their baseline is on the depressed part of emotion. So their baseline is different from normal people's baseline. So normally or not normally, but I mean like usually, or the default setting, like the default setting of their mood is depression. I use this kind of metaphor. So yeah, sometimes you buy a cell phone or you buy a laptop, there is some kind of default settings, right? Their default setting of mood is depression. But for normal people, the default setting of mood is calmness, is not too happy, is not too sad. So this is a feature of symptoms of a major depressive disorder. And also there is a questionnaire there that people can take to judge whether one has a major depressive disorder or not. So you can find online, and it's everywhere online. You can find one and then do that questionnaire, and to have a self-diagnosis. But it's not really reliable, because it's not really professional. But you can, if you think that you might have that tendency, you think that you have this kind of symptoms, you can do that questionnaire, and to see if you have a major depressive disorder or not. So remember that the person must be sad or depressed for more than 2 weeks. That lasts very long time. And also, at the same time, they lose the interest in life. They lose the enjoyment. They do anything without any enjoyment for more than 2 weeks. This is a major depressive disorder. And another kind of a disorder that we can introduce here is schizophrenia. So what is a schizophrenia? It is categorized by major disturbances in thoughts, perception, emotion, and behavior. So schizophrenia is different from mood disorders. It's different from anxiety disorders. For those disorders, the major problems are the problematic moods and emotions, such as anxiety or depression. But schizophrenia is another kind of a category of mental psychological disorder. So you can see people who suffer from schizophrenia, they have problems in every aspect: thoughts, perception, emotion, and behavior. As every aspect of their life, they have the problem. So there are major symptoms for the people who have the schizophrenia. First one, hallucination. So what is that? People can see, hear, or smell things that do not exist. So see some things that don't really exist, but they can see them. They hear some sounds that do not really exist, but they can hear them. So this is hallucination. That is not because they take drugs. So some kind of drugs can create hallucinations in people's mind. But people who suffer from schizophrenia, they don't have to take drugs so that they can, but they still can have the hallucinations. And the second symptom is the delusion. So they have the beliefs that are contrary to reality. Means that they have the beliefs that do not make sense at all. Those beliefs they shouldn't have those beliefs. Nobody should have those kind of beliefs, but they have. For example, some people who suffer from schizophrenia often think that there is a guy who follows them and try to kill them. And that doesn't make sense, right? There's no one who wants to kill them, but they have this kind of belief. This kind of belief is so strong in their mind that they believe so true. They think that this is so true. This is reality. there's a person who wants to kill them, but it's not real, it's not true, but they believe that that is true. And the third symptom is the thinking pattern that is disorganized. So it's like a dream. Their thinking process is like having a dream. Their thought processes are incoherent, is disjointed. And that's why the patients who have schizophrenia may say something or say some words that do not make sense at all. Their words are really disjointed. They say something at the beginning and suddenly they change the topic to talk about other things. And their words are not consistent, not coherent. So because their thinking is really disorganized. And also they have some kind of abnormal behavior. They have really unusual movements, such as repeated movements. They have a certain movement repeatedly. They do some kind of movements again. It doesn't make sense at all. Normal people will not have those movements for so many times. And some kind of movements are purposeless, so they do not have certain purpose to do those actions, to do those movements. Because their mind is not usual, so they have the unusual or abnormal behaviors or movements. And the next symptom is that they sometimes have the negative symptoms. It means that they have there are decreases or absences in certain behaviors or emotions that they should have. For example, the lack of facial expressions. So for normal people, when we talk, when we do things, we often have emotions, right? So we have the certain facial expression for certain emotion. For example, when we are happy, we laugh. When we are sad, we cry, or we have the facial expression to expressing sadness. We can tell that other people are sad or happy, that, right? So we can tell that because other people, everyone has the facial expressions to express the emotion. But sometimes the patients who have schizophrenia, they don't have facial expressions. When they are happy, they don't have that facial expression. And they are sad, they don't cry, they don't show that expression. It's really weird because they have dysfunctions in their mind. So this is a negative symptom. So they should have some kind of behaviors or emotions, but they don't in certain situations. So schizophrenia have all these kind of symptoms. Thinking is problematic. Behavior is problematic. And also the sensation is problematic. Also, they have hallucinations. So what is the reason of schizophrenia? So they studied the brain that of the people who suffer from schizophrenia. Of course, those patients have died, and they got the brain of those patients who have died. They found that the brain of those people are much smaller than the brain of those who are normal. So for normal people's brain are much larger than the brain of the people who have schizophrenia, because their brain is shrinking when they are alive. So that there's not enough neurons for them to function normally, so that they have this kind of abnormal thinking and behavior patterns, and they have abnormal sensations. So let me give one example. So why they have hallucination? because they cannot tell the difference between imagination and reality. Because our brain can imagine something happen. We can simulate, our brain can simulate something. We can simulate things that we can see. We can simulate the sounds we can hear. But for normal people, we know that. We know that what is reality, what is the imagination. We can imagine things. We know that that is in our imagination. We can have a sensation. We can hear, see things. We know that, oh, that is from the reality. We can tell the difference. But for the patients who have schizophrenia, they cannot tell the difference because there is one way in the brain that controls this. So one part of the brain that is responsible for imagination must send the signal to the awareness, to the frontal lobe, to tell the frontal lobe that, oh, this is imagination, this is not reality. There is a pathway between two parts of the brain. If the pathway is damaged or destroyed or does not work very well, people cannot tell the difference between imagination and reality. They will take something that they imagine as something real. That is why people have hallucinations. Oh, because they feel that, oh, this is so real. This is what I really see. But that is from imagination. Because in their minds, that pathway is damaged. The brain, that part that is responsible for imagination, does not tell the awareness that, oh, this is imagination. This is not real. And another example, why schizophrenia patients have negative symptoms. Because the part that is responsible for facial expressions, the pathway between the two parts, one part is pathway between two parts is damaged. One part is for having facial expression. The other part is for the creation of emotion. So the pathway between these two parts is cut off or damaged, so that they have emotion, but they lack the facial expressions. So this is about schizophrenia. And the next disorder is about certain kind of behavior. It's called obsessive compulsive disorder, or it's called OCD. What is that? So there are two major symptoms in this disorder. So first one is obsessions. They have a lot of obsessions in their mind, thoughts and urges that are unwanted and intrusive. They oftentimes have some kind of thoughts they do not want to have, but they cannot control that. They do not want these thoughts, but they oftentimes have. And also they have compulsions. The need to engage in repetitive behaviors or mental acts. They are really compulsive to do something again and again, or they are compulsive to think something again and again. So this is obsessive compulsive disorder. They have some kind of thoughts that they do not want all the time. And also they have the compulsions to do something or to think about something. They cannot control this. They do not want this, but they cannot control this. So there are some common examples. There are different kinds of specific symptoms. I mean, all these symptoms are compulsions and obsessions, but they have different kinds of acts and thinking. So for example, is like sometimes some patients have repetitive hand washing because they always think that, oh, my hands are too dirty. I touch something, that thing is too dirty. I touch that, so my hand is so dirty. I must wash my hands. They cannot control this. They always have those kind of ideas that things are too dirty and their hands are too dirty. They must wash their hands again and again and again, every minute. I saw a documentary that there's one patient that washed her own hands every minute. Every minute, wash the hands. And also another example is the repetitive checking if the door is locked or checking the windows are closed. Because they always think that the door is not locked and the windows are not closed. They must check to see if the door is closed. And another example is repetitive checking if the stove or faucet is turned off. Same logic here as, yeah, so they always think that the stove is not turned off. So they always check. And another example is like things must be placed in a certain order. So these things in the room must be placed in this particular order, not in other orders. Or the things must be placed in symmetry. So there must be a pair of everything. There cannot be just one thing placed there. It's not okay. So they have the compulsions to place those things in certain orders. So this is obsessive compulsive disorder. There's one example is that the really famous soccer star, like soccer player who was really used to be very famous, whose name is David Beckham. He was the player in England. So he said to the public that he had a certain kind of obsessive compulsive disorder, that he must play something in pairs or in symmetry. So for example, the cup must place in pairs. And there cannot be one cup there. Must be a pair of cups that is placed in symmetry. So everything must be in pairs. Must be 2 or 4 or 8. Cannot be 1, 3 or more. And next, we can talk about how to give treatments to the people who have psychological disorders, how to cure the psychological disorder. So there are some kinds of a therapy and treatment. So there are different types of therapies. So there are 2 major types of therapies. So one type is called psychotherapy. Psychotherapy. So in a psychotherapy, that is a psychological treatment using a group of strategies or methods to help patients overcome problems and or help the patient's personal growth. So majorly, they use kind of psychological ways to give treatments. So help them to overcome these mental problems and help them to have a better life. So in psychotherapies, they majorly use psychological principles and use in a psychological way, they cure these patients. And another types of therapies is called biomedical therapy. They use medication or medical procedures to give treatments to the patients. So biomedical therapy majorly uses knowledge from medication, from medical principles. So prescribe some medications to the patients take them. It's like a way to cure some biological diseases. So these are two different routes to give treatments. Psychotherapy use psychological principles to figure out what is the problematic thoughts, what is the problematic behaviors. So what is the reason for why you have those psychological disorders? So what is the development processes of those patients? So this kind of route. But biomedical therapy treats psychological disorders as other diseases, other biological diseases. Just give medication. You have this kind of example. You have this kind of a problem. I prescribe you this kind of medication. You take it, and that symptoms is gone. It's gone. It's okay. It's cured. So there are two major categories of therapies. And let's talk about certain psychotherapies. Let me briefly introduce some psychotherapies. First one, psychoanalysis. This is a therapy that is invented by Sigmund Freud. So we talk about Sigmund Freud in the first week of lecture, and we talk about Sigmund Freud at the last week of lecture. He had a total spectrum, or he had a theory of psychology or people's minds. And also he had the strategies to cure psychological problems. So what it is about psychoanalysis? So in psychoanalysis, it's consistent with the philosophy, the understandings of Sigmund Freud about human minds. So psychoanalysis assumes that those emotional or behavioral or psychological problems come from impulses that were repressed and the trauma experiences in childhood. So before people grow up, when they are children, they have a lot of traumatic experiences. And those traumatic experiences are in the unconsciousness already. And there are a lot of impulses that are repressed. Repressed means that those impulses want to be obvious, want to express, but they are controlled, they are ignored, they are pressed down to the unconsciousness. So in other words, children have a lot of impulses from the id, right? So we talk about id, ego, and superego, right? So there is a strong conflict between id and the superego sometimes. They have to deal with this kind of conflict. So they repress these impulses from id. They repress them and they control them, and then they put them in the unconsciousness. This is automatic. This is not a conscious process. So the mind of every child just work on this and repress these impulses into unconsciousness, so that the child does not know that, forget about that. And also children have a lot of traumatic experiences, a lot of difficult times. They cannot deal with this. They cannot explain why they have these traumatic experiences. These experiences create a lot of hurt to the child's feelings. And they try to deal with these traumatic experiences, these memories, so that they put these experiences or memories into unconsciousness. However, it's not really a proper way to deal with this difficulty in life or impulses, because these impulses and the trauma experiences persistently create problems, psychological, emotional, behavioral problems when they are adults. So they try to get rid of all these impulses and trauma experiences, but they cannot. Those things are continuously creating problems in adult life. So the therapist who use psychoanalysis needs to find these trauma experiences and impulses, need to uncover them through different kinds of methods. Why it's a lot of work to work on this. Why is that? Because those patients bury those impulses and the trauma experiences too deeply in their unconsciousness. They cannot themselves find those things. They are not aware of those things, but those things are buried in their unconsciousness very deeply. So the therapist must dig them out and say what are there, what they are. Need to find those. What is the trauma experience? What is exactly the impulse? So the therapist's job is to uncover those trauma experiences and impulses from unconsciousness and really kill those impulses and the trauma experiences. So there are different methods. The first one is called free association. So the patient just says whatever comes to mind. So sometimes the consciousness is not really working well because they are relaxed. So sometimes the stuff from unconsciousness comes to mind, and the patients talk about them so that the therapist can know them. And the second way is the dream analysis. That is a way invented by Sigmund Freud. So the patients can talk about the dreams, the dream contents, what they have dreamed about, and they can talk about this to the therapist. The therapist can interpret the dreams, interpret the underlying meaning of dreams, because Sigmund Freud believed that every dream is not totally random. There is some kind of associations between the stuff in the unconsciousness and the content of the dream. In other words, the dream wants to tell the person something in the unconsciousness. However, the dream is severely distorted. So the content of the dream is severely distorted. You must interpret underlying meaning of dreams. The shadow, on the shadow layer of the dream is different stories. Is random, does not make sense, it's not logical. But it has been distorted. You need to dig out the real meaning of dreams by interpreting them. You need to repair the distortions of the dream so that the therapist can know the real meaning of dreams. So actually, there is an understanding that sometimes the mind and the physicality want to tell the person what is real going on in unconsciousness. However, the consciousness of that person always ignore and avoid the message from unconsciousness, because the consciousness does not want to deal with those impulses and the trauma experiences. It's not pleasant. So the therapist need to help the patient to figure out using different kinds of ways. So free association and the dream analysis are just two ways. There are a lot of other ways, but I'm not really familiar with this method of psychoanalysis. So it's just a really brief introduction about what psychoanalysis is. You can know more about this online on YouTube. You can find more videos talking about psychoanalysis. It is very traditional and long history therapy to cure mental illness or psychological disorders. It's very famous and it has very long history. Another kind of therapy is called behavior therapy. So the goal of behavioral therapy is to change some kind of undesirable behaviors, or the goal is to shape new behaviors, create new behaviors of that patient. And those behaviors are desirable. So behavioral therapy comes from the age that the psychology focus on changing behaviors. Come from the age that people believe, psychologists believe in behavioralism. So they use the principles of learning, basic learning principles, such as classical conditioning and operant conditioning. So they use this kind of conditioning principles to change patients' behaviors, get rid of those problematic behaviors and create new behaviors that are desirable. There's one example. So one example, there is a kind of a conditioning, it's called aversive conditioning. So the application of this conditioning principle is the therapy to help smokers quit smoking. So how to help smokers quit smoking? There are different ways, but one way is to use the principle of aversive conditioning. So those smokers must use or take a certain kinds of special type of cigarettes. In those cigarettes, there is a bad taste that is added to the cigarette. And when the smoker smokes the cigarette, they feel disgusting because of bad taste. When they feel disgusting. So they do not want to have the feeling of disgusting so that they quit smoking. So this is a principle of aversive conditioning. Add something that people try to avoid. So you repeat this process again and again. That person gradually avoid that thing, right? So add some bad taste to the cigarettes and let the smoker smoke those kind of cigarettes. And every time they smoke cigarettes, they feel disgusting, but they do not want to feel disgusting. So the better way to do is quit smoking, right? Do not smoke again, because every time that the smoker smokes any cigarettes after aversive conditioning, there is a feeling of disgusting because of the conditioning principle, classical conditioning principle, the bad taste is strongly associated with the behavior of smoking. So after smoking this kind of a special cigarettes, the smoker will feel disgusting whenever he or she smokes any kinds of cigarettes. So this is how conditioning principle helps smokers quit smoking. So associate unpleasant stimulus to the behavior. So to try to get rid of unpleasant stimulus, avoid the behavior totally. This is a behavioral therapy. And there is another example that I heard of. For example, from a soccer game, a soccer player tried to get the soccer ball, and his head hit another person's head. And later he did the surgery because his head was severely hurt by another person's head. Of course, that person also got hurt on the head. Later, this soccer player had a really severe problem. He couldn't think of soccer. He couldn't touch the soccer. He couldn't go to the field and play soccer anymore because he was too afraid of anything about soccer. You know that he got traumatic events. He was so stressed when thinking about soccer. So what is a therapy? So the therapy that the therapist told them to do is to watch the scenario, watch the video that that the soccer player himself hit another person's head. Watch that part only. Again. So later, he got used to it. He found that, oh, it's not a really big problem. Even though he had a really traumatic event on the field, but it's okay. It's still okay to play soccer. Because before, he was too sensitive to this traumatic event. So after watching that part of the video, recording that part of recording again, he was not that sensitive to that moment at all anymore. So that this also used the conditioning principle. Okay, this is a behavioral therapy. And there's another kind of therapy, it's called cognitive therapy. This kind of therapy is assume that why people have disorders, that is because of problematic thoughts, because people have thoughts that have problems, so that they have those emotional and behavioral problems and psychological problems. So how you think can influence how you feel and how you do things. And one example is how people are stressed, right? So stress is not directly from those stressful events, but from the appraisal process. So when the event is happening, there is a evaluation or appraisal process in people's mind. People might interpret that event as a threat to somebody's well-being. That's why people are stressed. So thoughts create problems, right? So if that stress is really problematic, that is because of the wrong interpretation of some kind of events. So misinterpretation of a event or situation causes problems. So that example is from stress, and there are other kinds of problematic emotions and behaviors because of misinterpretation of the situation in life. That is basic assumptions from cognitive therapy. So all kinds of cognitive therapies use these assumptions and figure out the problematic thoughts. What kind of thoughts are problematic for those patients, and change the problematic thoughts. When the thoughts are changed, the problematic thoughts are changed, and they have the healthy thoughts, the problems are solved. That is the basic logic of cognitive therapy. So cognitive therapy has a totally different logic with behavior therapy. Also has a different logic with psychoanalysis. So these three kinds of therapies use different assumptions and different logic to give treatments. And also there can be a combination of cognitive therapy and a behavior therapy. There's a new kind of a therapy, it's called cognitive behavioral therapy, or it's called a CBT. It's a combination of principles from cognitive and behavioral therapy. And this therapy is very useful and effective. So combines cognitive and behavioral therapy. So at the same time, change the problematic thoughts and change the problematic behaviors at the same time. So there are two hands, right? So I use two hands to work on this problem, not only one hand. One hand is thoughts, and the other hand is behavior. I change thoughts and behaviors at the same time in this therapy. So there is one example of cognitive behavioral therapy. It's called a rational emotive therapy, or RET, rational emotive therapy. It's a therapy created by a really famous psychologist called Albert Ellis. So what is rational emotive therapy? There is assumption about this therapy. Assumption is that some kind of beliefs in childhood are not accurate or rational. So some beliefs are inaccurate and or irrational. Some beliefs does not make sense, that do not follow logic, are not rational, and also those beliefs are not right, not technically right. And those beliefs in childhood cause a lot of emotional and behavioral problems in adulthood. So those beliefs are still disturbing people's minds in adulthood. So those beliefs are from childhood, but they are not disappearing suddenly. They are always there in the mind. And when people grow up, they still have those beliefs. Sometimes they already forget about that, but they still have those beliefs. Those beliefs are still working on creating emotional and behavioral problems in adult's life. So that's assumption of RET. That is explanation for where the problems come from. There is a specific pattern that how problems emerge. So first, there is a event happening. There is a event. And next, there is a belief about that event. There is an interpretation or explanation for why that event is happening. There is a belief about that event. And the C, next step, there are some emotional consequences that follow that belief. So A is the thing, the event. B is the belief about that event, and C is the emotions that follow that belief. So there is a concrete example about this pattern. So in A, something occurs. For example, there is a little girl called Sally. Sally's parents abandoned her as a child. So her parents abandoned her when she was young. That thing happens. What is the interpretation of this? Sally believes that this is her responsibility. Sally believes that that is her fault, so that her parents abandoned her. And as a result, Sally feels depressed and worthless. She feels that, oh, this is so sad. This is so sad. Because of myself, I got abandoned by my parents. I want to see my parents, but I got abandoned because of my fault. Also, Sally feels that her life was worthless, not meaningful. So you can see the problem here. So a couple abandon their own child. What is the reason? Who is responsible for that behavior? Apparently, this couple is responsible for this behavior, right? So not because of that child. The child is innocent. Because this couple is not good, that this couple abandons their child. But Sally, this child, believes that believe that this is because she is not good enough or she is bad, so that her parents abandon her. So this belief is totally wrong. It's totally irrational and inaccurate. So that she is always she is always depressed and worthless, even though she grows up. So the task of the rational emotive therapy is to help people dispute some wrong beliefs. In other words, the connection between the event and the belief must be cut off. The connection between A and B must be cut off. Because the link between A and B is not rational. It's not rational to believe that way, right? So the event is the problem. The belief is the problem. The link between A and B is the problem. So the text for the rational emotive therapy is to cut off the connection between A and B. When B is not there, C is not there, right? So when the faulty belief is gone, the emotional consequences are gone. The emotional and behavioral problems are gone. So this is the basic steps of rational emotive therapy. Okay, so this is all the stuff for this lecture video. And here are some things that you need to know for this week. You need to know the following concepts. First one, psychological disorder. You need to know this for sure, psychological disorder. And you need to know the name of the book for diagnosing psychological disorders. That is the Diagnostic and Statistical Manual of Mental Disorders, or DSM-5. You need to know the name of this book. You do not have to know the details of this book. And you need to know about diathesis stress model. That's a model that tells us that there are predispositions and environmental factors that create psychological disorders. And you can know some kind of a specific disorder, such as generalized anxiety disorder. You need to know what it is. Social anxiety disorder, you need to know what it is. Major depressive disorder, schizophrenia. So these are 4 disorders that you need to know about. And you can know about 2 types of therapies. So you can know the difference. You can know what these 2 kinds of therapies are about psychotherapy and biomedical therapy. And you can know about specific therapies, behavioral therapy. You just know the basic notion of this therapy, behavioral therapy and cognitive behavior therapy, or CBT. You can have a basic understanding of these 2 therapies. And you need to know the RET, the rational emotive therapy. That's the specific therapy that we talk about. RET is a type of CBT. So it's a kind of a cognitive behavioral therapy. Okay, this is all the stuff that we need to know for this week. And thank you very much for watching this video. And this is the end of all the lectures. We do not have lectures anymore for this course. And good luck, and hope you are enjoying this course. And next week, we are going to review for the final exam. So see you next week.